I'm 67, and that puts me in the prime level that if I get COVID, I've got potentially a 1 in 20 chance of dying. I wasn't willing to take that gamble, particularly when I blamed the fact we're in this situation on mainstream economists ignoring the physical world in the first place. Because the first warnings about the potential of a pandemic came in 1993, I thought in 94, with a woman called Christine Garrett, who was the New York Times health reporter, and she went through the very, very detailed study called The Coming Plague and warned that it was going to happen. We had America, of course, Trump disbanded the pandemic unit in 2018. God knows what happened inside Boris's cabinet and the Tories, but you guys had, there was a World Health Organization saying the two countries best prepared to handle a pandemic are the USA and the UK. Well, look what they've damn well done. Sheer incompetence. Partly it's ideology, the whole belief that you can have freedom without responsibility. I call that freedom. Is an American obsession, but it's also part of the Western mindset. Countries like Thailand have got Marx used to talk about the Asiatic mode of production. And a large part of it was that because this is a monsoonal part of the world, you have to have waterworks to control the rainfall. You can't rely upon it just drizzling out of the sky like you do in the UK. So you had to have a big state to build those systems. Irrigation systems are the rule in this part of the world. So there's a respect for a central authority coming out of that, and much more powerful. The feudal system in the Asia was much, much stronger than the feudal system in Europe, and particularly, of course, in the UK. So the ideology over here has got an element of the state having a legitimate role, and feedback between the state and the populace as well. Even though there's elements of authoritarianism here, you don't want to have the peasants revolting over here, okay? You simply don't. So that fear of what could happen if you don't make the populace reasonably content is a large part of what replaces representative democracy over here, and is quite successful at it. And also, of course, Thailand and China and a few other countries had the SARS outbreak back in 2008. So they were ready, they produced their own masks, they had pandemic plans, they had pandemic authorities in place. As soon as the pandemic hit, they did lockdown. There are 65 regions, I think, in Thailand, 65 provinces. Some are very big, like Bangkok is 15 million people. But they broke those into divisions. You could not move from one to the other. The only thing which could go through were food deliveries, and you had to be tested on the way in and the way out. You couldn't go into a shop without a mask. You could buy masks over here at a government set price that involved a 20% profit for the manufacturer, a price of 10 pence per mask. So myself and my partner were picking up 4 per day for each of us. But the first month we were here, we've got a stack of a couple of hundred of them over here. Nobody ever ran out of personal protective equipment over here, okay? And the social distancing, hand cleaning, masks, total lockdown, any activity to transmit disease collectively was not possible. You couldn't go to a restaurant, you couldn't go to a gymnasium. I gained a large amount of weight courtesy of that. I'm now trying to work it off. That worked brilliantly. And so when I left Europe on March 18, I arrived here in March 19. When I left, it was because I was seeing this explosion in numbers in the UK and Netherlands, which are the two places I can live in Europe, flatlining over here. And I expected to delay how long it would take me to get the disease. Instead, it's been eliminated. Total number of cases in Thailand below 4,000. Daily cases are below 10, and they're all coming in through quarantine. There have been 4 breaches of quarantine in the last 4 months. They've led to 0 subsequent cases, again, because of masks and so on. So a strict lockdown initially, very successful, and then opening up intelligently and maintaining masks as a compulsory limit. You can't get onto a train, you can't get into a taxi without putting a mask on in this country. And that meant that even if somebody does get into the public transport, they don't pass it on to somebody else in that system. So just forget all this garbage that you see the Tories and Labor going on with over there. Get some Thai experts to come along and tell you what to do.